So immunological disorders is our last topic, and it really is in this second chapter in your guys' book, right? They kind of cover adaptive and disorders all in one chapter. It's an enormous chapter, right? If you've read through it. And so we're going to talk about hypersensitivities and autoimmune disease and immunodeficiency. So what do these things have in common, and what makes each one of them different from each other? So hyper means a lot, right? Sensitivity. So this is very sensitive to stuff that we don't necessarily need to be sensitive to. We don't need to mount our immune response to. Not to say that it's any more of a response than we normally do. The problem is what we're responding to isn't something that would hurt us, right? So that's where the hyper comes in. Autoimmune, as the name implies, auto means what? Self, right? So in this case, the immune system is attacking our own body, right? So these are autoimmune diseases. These are diseases that are a result of our immune system damaging us. So not getting that correct information of the difference between self and non-self, right? It is in this case attacking self and causing damage to the body. Immunodeficiency, what does it mean to be deficient? Lacking, without, right? So in this case, the immune system, right, is not working properly. It is deficient. And as you know, the reason why you're not sick sitting here right now is because your immune system is working. If your immune system becomes deficient, then you're definitely going to get sick at some point or another. And the bad news with that is some of the infections we don't have treatments for, right? It is really your immune system that saves your butt. So it's really scary and not great when you're experiencing immunodeficiency. Now, this could be something you're born with. You could have a genetic defect in your immune system. Or it can be something that's acquired. And the most common thing that we know we link with immunodeficiency is a virus, right? Anybody know the name of that virus that can make a person's immune system deficient? HIV, right? It's in the name. H stands for human, I stands for immunodeficiency virus. But there are other infections that can overwhelm your immune system so much so that your immune system can become deficient during that infection. And then we talked last time about how people, when they get organ transplants or tissue transplants, they purposely take immunosuppressive drugs to suppress their immune system from eliminating that foreign organ or tissue. Because of that, right, it puts them at a certain level of deficiency, which means they're more susceptible to infection in general because their protection mechanism, right, we're interfering with. So all of these have in common as that they all are our immune system, right? It's either functioning overly to something we don't want it to respond to in the case of hypersensitivity. In the case of autoimmune, right, we're attacking self. It is our immune system attacking our own self. And then the bad news with immunodeficiency is that for some reason the immune system is not working properly. So when we look at hypersensitivities, there's 4 different types. And so, of course, they number them, 1, 2, 3, 4. But we're not going to stick to just the numbers. We're going to take into account the whole title, official title. So type 1 is immediate IgE mediated, and in that title it tells you a lot about this particular type of hypersensitivity. It's also commonly referred to as allergy. So on the test, I won't just write type 1. I'll write type 1 immediate IgE mediated, the complete title. So you need to be able to describe, right, understand the reactions, what happens in this type of hypersensitivity. And we're going to go over 4 different examples of type 1 hypersensitivities. So as the name implies, IgE is at the root of this problem, right? The production of that particular class of antibody. Hence why, again, me, Erica, is not very fond of IgE, because this is what we typically refer to as allergy, right? The IgE is the reason for the hypersensitivities to things that wouldn't normally hurt you, like pollen, penicillin, right? Penicillin, you take it to destroy bacteria, not your cells, right? Peanuts, shellfish, right? Stuff that isn't truly pathogenic, but it's definitely not self, right? So the immune system is doing its job in the sense that it's recognizing that it's non-self. The bad news is that it's not actually something that would harm you. Also, as the name implies, it's characterized by the reaction can be immediate. Literally, I kid you not, within seconds. This is once you've been what we call sensitized. What this means is you've already had a prior exposure, because how is it that we make IgEs? Where do antibodies come from? Plasma cells, right? And that plasma cell differentiated from a lymphocyte we call a B cell. And that B cell doesn't just make antibodies to make them, right? It had to interact with that substance, say grass pollen. And then it became activated, maybe with or without a T cell help, depending. And at some point it also class switched, because typically what class of antibody do we make first? The mega big one, IgM, right? And then at some point the body switched to making IgEs. So that very first exposure is sensitization. You're now, as sensitive individuals, you have IgEs against whatever it is you're quote-unquote allergic to. Right? That allergen is the antigen in this case. That foreign substance. So once you become sensitized, you have those IgEs. In each exposure, you're going to produce even more IgEs, because what's going to be stimulated in that case upon your second exposure? The memory cells. She's my memory girl. Yeah, memory cells. So the unfortunate thing for people like myself who have allergy, each time you're exposed, right, you produce more and more and more, and the reaction can get even more dangerous depending on where this reaction is happening, or even more uncomfortable. So although this is a relatively old number, it's probably higher than that now. About 20 to 30% of the population, right, have type 1 hypersensitivities, what we call allergy. And unfortunately, this tendency to go to producing IgEs is inherited, right? How your body functions, what it does, all that information is coded in your DNA, right? So if your parents were predisposed to having allergies, you're probably going to end up with allergies, right? You have about a 50-50 chance. If both your parents have allergies, you have a really strong chance of potentially having allergies. So in my case, my mom has allergies. I have allergies. My poor son has allergies. Do you see this trend? Right? It sucks. Could be worse, though, right? Could be more damaging, inherited things. So, there's 2 different general types, what we refer to as local anaphylaxis, right? Ana meaning against, and generalized. So local means it's in a particular area, right? So for me, who experiences nasal allergies from the pollens that I inhale, right? Although very uncomfortable not being able to breathe through your nose, it's not necessarily life-threatening, right? Unlike people who have ingested type allergies, like foods, when you eat something, it goes into your what? Goes into your stomach, goes to your small intestine, it gets absorbed from your small intestine into your what? Your bloodstream, right? And this is what's bad about that, is then it can travel your entire body. So that's generalized, right? The entire body could be affected. And again, anaphylaxis is that term of the immune response typically related to this type of response of IgE. So I'm not going to play through this. You guys have all these links, right, too. I'm just going to skip ahead to one particular point. So remember that whole process we've talked about getting to the point where we're actually producing those IgEs. So there's those B cells, plasma cells. Unfortunately, they're producing IgE. IgE binds to the surface of mast cells and basophils. Okay? These cells contain granules, right? Those vesicles that contain substances that are going to usually elicit an inflammatory response, right? That's the normal immunological response. Get white blood cells here, take care of the problem of the bad guys that have gotten in. The bad news here is something like pollen or peanuts. It's not something that's actually going to grow in your body or harm you, right? But again, your immune system is just targeted to recognize stuff that's foreign. These mast cells will stay coated in antibodies for weeks. Right? So once you become sensitized, you produce these IgEs. So that's another question. The first time you're exposed, how long before you produce these antibodies?
About 10 days.
Yeah, 7 to 14 days is the range. So the very first time, you probably don't even know anything happened. The bad news is that you produce these IgEs, and they're going to bind to these mast cells and to basophils. And they'll stay attached there for weeks. So the minute the allergen comes into your body, or literally the seconds that it comes into your body, it will bind directly with these antibodies. So there's your allergen, right? Binding with the antibodies already on the surface of the basophil. So it's not one of those situations where the antibodies coat the antigen and then you're waiting for the effector cell to come along. The effector cell is already coated in these antibodies. So that when you inhale that allergen or ingest it, it binds to the antibodies already on the effector cell. So then the effector cell immediately responds. In the case of mast cells and basophils, the types of things that they release are things like histamine, which is going to cause inflammation, right? Capillary dilation, right? In the case of in the lungs, it can cause airway constriction. In certain areas, too, it's going to increase mucus secretion because obviously, right, the body's going, something foreign has gotten in. We got to trap it. We got to get rid of it, right? So more mucus is going to allow us to trap more of it. You'll have pain, again, associated with the inflammation in the area and the mediators that these release. And then sometimes also you'll experience itching, although I don't quite understand the mechanisms of that. But it happens, right? And itching doesn't mean that you have an allergic reaction because it can happen even when you have infection. Right? So this is just schematically drawn out, and the really important thing is that first exposure makes you what we call a sensitized individual. And so that second exposure with those antibodies already there, you get that immediate reaction that can literally happen within seconds. Also, what they don't show you here is this allergen can also bind to memory cells and produce even more antibodies, even more IgEs. So this picture is actually of a skin test done on someone to determine what they're allergic to. So I've unfortunately been through this. It wasn't, you think that looks bad? I wish I would have known I was to become a teacher back then. I would have took pictures to share with y'all. But they purposely, the drawn pen lines you see on here, this is to keep track of what they put where, right, on your arm. They usually typically do it on your inside of your forearm here. And they did both my forearms and even across my back. So for me, they did most of the animal allergens on my right arm, and on my left arm they did most of the environmental allergens like pollens and dust and stuff like that. And they did all the common food allergies across my back. So I wanted to be a veterinarian back then. So I had a very large population of animals at that particular time. Mine's a lot smaller population right now. That's only because I live in the city now, and I didn't before. So I was staring at my right arm going, if you puff up, I'm just going to cut you off, because I cannot be allergic to my animals. In the meantime, my left arm was swelling unbelievably. So much so that I could not wear my watch that I typically wear on my left hand for about a week after my allergy testing, and I had to take steroids after my allergy testing to get the inflammation to go down with my arm, because one of the ones that I was allergic to, I was extremely allergic to. So because of that, because some people can have quite serious reactions to, there's other ways that they can test nowadays. One of the things they'll do, and I went through one of the therapies we're going to talk about in a moment. When I went to my allergist not so long ago, I was like, I'll go through allergy testing again if I have to. I was like, I'm that miserable right now if I've got to go through that whole gamut. But you still had my information in the system. He said, well, let's see where you're at for certain ones. We can run blood tests now, which makes sense, right? So they are able to take a blood sample from me, and in the liquid phase of your blood are the antibodies. So they're able to take those antibodies and see what allergens, right, my antibodies are binding to. And so he was able to get an idea, again, for the general ones that I was allergic to, which ones I was really still very allergic to, right, still producing a lot of IgEs. And so, of course, the grasses were on that list, right, because you really can't avoid exposure to those. And so my body's constantly exposed. The one that blew up my arm was actually thistle, which is a weed, right, that's very common here. And apparently I'm no longer allergic to that one. So that was pretty cool, and that's because of the desensitization therapy that I went through that I'm going to talk about next. So, there is hope, right? There is more advances, and the more we learn about the immune system to try and combat some of these things. So hives is an allergic condition characterized by the formation of this wheal and flare that you see here. So the flare is the that inflammation that's really puffy. The flare is the redness. And again, this is just cardinal signs of inflammation. So when they inject that allergen in, that person has the IgEs. Those mast cells are releasing things like histamine, and they're setting off the inflammation cascade. So when people experience hives, it could be because they've come in contact with something with their skin, right, and they get that reaction. Another reason why some people get hives is if they ingest something. And in that case, if it's an ingested allergy, anyone know where you tend to see the hives first, where on the body? Your stomach, right? Because think about it. Again, your small intestines in your abdomen region, that's going to be the first cells, the skin associated with that region, those are going to be the first cells that receive the blood, right? They're closest to the source. They're going to receive the blood first that unfortunately is tainted with this allergen, and cells in the skin are responding, and you get that inflammation. So typically it'll arise on the abdomen first, and then it'll spread. And again, this is because the allergen is spreading through the blood, which also feeds your skin. Now, some people experience hives apparently for other reasons, even things like stress can apparently set off mast cells and cause you to have a rash on your skin, commonly referred to as hives. So those are some key indicators on why you may have that rash, right? Especially if it's developing on the abdomen. It's probably something you ingested. Hay fever is what I experience, unfortunately, daily. And that is related to usually inhaled allergens. So this affects your nose and even for some individuals, their eyes. And again, it has to do with this localized response where it's happening for the eyes and the nose. And again, it's a normal immunological response, right? Your immune system is going to produce more mucus, right? You're going to end up with a runny nose because your immune system's trying to flush this stuff out. You get the inflammation, right? The stuffiness as, you know, cells are heading to that area, blood vessels are becoming leaky. And the unfortunate thing is your nose is connected to your sinuses, which are the cavities in your skull. And so inflammation can even spread to that level and even in your inner ear, right? Your nose is connected to your inner ear. So this can cause real problems for people as you get fluid building up from the inflammation. This is also why someone's voice changes in response to their level of stuffiness, because your voice resonates through these cavities in your skull, your sinuses. And so when they're filled with fluid, your resonance changes, your voice changes, right? And you quote-unquote sound stuffed up. Right? It's one of the ways you can actually tell, right? So in that case, it would be more than just someone telling you they're stuffed up. It wouldn't necessarily just be a symptom. You could actually, it could be a sign too, because you can actually tell, if you know the person, how they normally sound. Of course, for me, it's like a constant stuffed up. You guys probably wouldn't even recognize me when I'm not stuffed up, my voice. Right? So in asthma, which happens to be probably, I think, one of the scariest ones out of these local type reactions where it's confined to a particular area, hives, the skin, hay fever, the eyes and the nose, and sometimes the ears and the sinuses. Asthma is one of those ones that can really be life-threatening because of where it's happening, right? Where you need to be doing gas exchange, this is impeded by the inflammation response because of inhaled allergens making it to the lungs or to the bronchioles that lead to the lungs. So you, again, get that inflammatory response. You get spasming of the bronchioles that carry the air to the lungs. And so I have a friend who's asthmatic, and I don't wish that on anybody. I'm terrified when she has an attack. I can't even imagine if it was happening to me. I was like, you know, if I had the choice between asthma and hay fever, I'm kind of happy with the hay fever. I'll take that. Because asthma can be quite terrifying and life-threatening, right? Because of the need to actually do that gas exchange and how this can impede that that process. And again, it's your immune system responding to something you inhaled, seeing it as foreign, and responding in a way to try and keep it from getting in, but unfortunately also keeps you from breathing. General anaphylaxis, although rare, much more serious. And this is where, as I said, the allergens actually enter into the bloodstream. And so that's where this reaction can then be widespread. Right? So this can be happening not just in your nose, not just in your lungs, but throughout your entire body. So this can induce a condition referred to as shock, and it's referred to as anaphylactic shock if they know that it's because of an allergen. But several things can cause your body to go into shock, even emotional status, right, under a severe stressor. It happened to me once when I was in a car accident. I don't even remember what I was saying, and the paramedic said to my husband, he's like, she's just in shock. She'll be okay. Right? That was an emotional shock. When your vehicle flips and spins on the interstate, there's no way you're not freaked out. There's no way. So what happens, though, when we refer to someone being in shock, is that it's usually an extreme drop in your blood pressure. And this creates a problem because then you're not getting perfusion, you're not getting blood to your vital organs like your brain and your heart, you know, the ones you kind of need always working. Just a little bit. And so depending on the cause of that, right, we'll try and combat it. But one of the quick fixes always is to give somebody fluids, because that's going to increase their blood volume, right, and help that perfusion. But if you're dealing with someone who has internal bleeding, right, they're just continually losing that fluid on the inside of the body until they can patch up that problem. The fluids are just not going to help the situation. If you're dealing with someone in the case of anaphylactic shock, right, they have to get some way of alleviating the problem. So because of that problem with the blood vessels dilating and having this very low blood pressure, anybody know what people who may experience this type of allergy carry around with them? An EpiPen. And what is in an EpiPen? Epinephrine. Epinephrine. And what this does is actually constrict the blood vessels, okay, and increases heart rate. And so I'll warn you guys, some dentists, that Novocaine they give you has a little bit of epinephrine in it to help speed up it numbing you. I went to the dentist once, got numbed up for a procedure, and my heart, I felt like it was going to just pound right out of my chest. I'm very sensitive to epinephrine. And I said to the dental assistant, I'm like, something's wrong. Something's wrong. I do not feel good. I feel like my heart is just going to jump out of my chest. And I was really nervous, too, because, you know, going to the dentist and having dental work done is never fun, right? But I knew it was not that. It was an immediate situation where I was reacting to something, right? And in that case, she was like, oh, yeah, it has a little epinephrine in it. You'll calm down in a second. You'll be fine. And I did. I was like, you know, you probably should warn somebody ahead of time, right, when you're gonna give them something like this. So for that, again, that's just a quick fix. They still got to go get medical attention to alleviate the problem and what's going on there. So again, it's an immunological response. Okay, so in the case of an allergy, it's to that allergen, but you can go into shock for many different reasons. Blood loss, right? Lots of other conditions can put you into shock, and so that's why it can be really difficult too for people, for paramedics and doctors and stuff to treat, to get at the root of the cause, right? And hopefully get you out of shock before you die. So this immunotherapy is referred to as desensitization. And what they do is, and I've actually gone through this therapy, not all the way through, unfortunately, because I moved out of state. And they actually make a cocktail of the allergens you're allergic to, specifically for you. And so normally I'm inhaling these things, right? And so that response is happening in my nose and such as that. They inject it into you. And the hope there is that you're going to produce a different class of antibodies. So something that generally goes into your body, which class of antibody do you think you're going to produce instead of E? IgG. IgG. And the hope is there that if we can get a person producing enough IgGs, that the IgGs are going to interact with the allergen, as you see in this picture, before they interact with the IgEs that are attached to the mast cells. And so that hopefully in time, too, you've switched the body to IgG production and it stops the IgE production. Right? So basically getting the body to class switch, because IgGs don't bind to mast cells and basophils, right? It's just IgE. So I went through this particular therapy for about 6 months. And I think that's one of the reasons why, thankfully, I'm no longer allergic to thistle. Because I've been desensitized. Not so much for the other things. There is hope out there too. I keep saying I need to call my doctor because he hasn't called me yet. The last time I saw him, they were in the last phases of FDA approval for a pill form for the major grass allergens. So you could take it orally, and hopefully, again, if you take it orally, what class of antibody do you think you're going to produce more of? IgA, and you could produce some IgGs. So especially for people who have inhaled allergens, think about that. The mucus in your nose, if it had IgA, it could stop it right there before, you know, it gets further past the mucus layer and interacts with the IgEs. One trick that's been known for a long time, which isn't always the easiest thing to get a hold of, is that wherever you live, purchase local honey. What does local honey have in it? Local pollen. Teaspoon of honey each day, right? Honey all by itself. Don't put it in your tea or anything like that. You don't want to denature or mess up those pollen. You could desensitize yourself that way. So I have a friend here, she swears by it. She takes her honey every day, and she swears her allergies have significantly decreased since she started taking local honey. So again, it's that principle of trying to get the body to switch to a different production of antibodies, one that's not going to elicit this hypersensitivity. So this immunotherapy I'm not going to talk about. I haven't had a chance to see if it's actually, you know, I like to talk about stuff that actually gets used for you guys, and I don't know to what level it actually is used anymore. But it's pretty high-tech stuff. No. 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 I didn't bother deleting the slide, but you can delete it, cross it out. It's interesting stuff, but save it for another time. So the next hypersensitivity is cytotoxic. So as the name implies, cyto refers to what? Cells. Cyto actually refers to cells. Toxic refers to what? Poison, right? Destroying cells. So in this, right, cells are going to be destroyed. Cells are going to be considered foreign. Cells are going to be destroyed. And it really wasn't until we started doing blood transfusions and we learned about hemolytic disease of the newborn that we really understood what was going on with what we call type 2 cytotoxic hypersensitivities. So the problem here too is the production of antibodies. So B cells are at the root cause, right? They unfortunately have produced these antibodies. And then as we talked about before, antibodies can interact with certain components of our immune system and cause destruction because of that, right? Those antibodies tag the cells for destruction. So antibodies can activate complement. And do you guys remember the 3 major outcomes of complement activation? What happens when we activate complement? So remember things like C3b, C3a, C5a, the MAC complex, right? So what does the MAC complex do? What does MAC stand for? What's the M? What does the cell have that would be destroyed? Membranes, right? Membrane attack complex. So when you activate complement, you can form these membrane attack complexes and insert into the membranes of cells, and what's going to happen to the cells? They're going to explode. They're going to lyse. So if an antibody binds to a cell and it activates complement, we could have lysis of that cell by the MAC complex. We could also have C3b binding, which really doesn't happen in this case, because these are actually human cells. And then inflammation too, right? You're going to get C3a and C5a, which are going to call white blood cells to the area. The other thing, and what class of antibodies can activate complement? There's only 2. The 2 major ones. IgG and IgM. The other thing can happen is when antibodies are coated in IgG, what cell will come along and grab onto that Fc portion and destroy that cell? He's a killer. The natural killer cells. And this process we call, remember, antibody-dependent cellular cytotoxicity. And this only happens with IgGs. Right? Natural killer cells only recognize IgG. And that's where that really comes into a problem, because in addition, IgG can travel where for a woman who's pregnant? Across the placenta to the baby. Right, so that's the bad news antibody when it comes to hemolytic disease in the newborn. It's the mom's antibodies crossing the placenta and attacking the baby's red blood cells, causing the baby's own immune system to activate its own complement, right? Because its immune system treats mom's antibodies as if they're his antibodies. So it can activate complement, and it can activate natural killer cells. The problem is, do we actually really want to destroy that poor baby's red blood cells? No, we kind of need them. A little bit important, just a tad. And transfusion reactions, right? That's the major problem. What happens when you get a transfusion reaction is if somebody screws up and gives you red blood cells that contain antigens on their surface that you have antibodies against. Your body's going to attack. The major antigens that create problems with blood transfusions are in what we call the ABO blood group. Your blood type in this group determines what antigens you have or don't have. If you have A-type blood, you have what we call the A antigen on the surface of your red blood cells. If you're AB blood type, you have both the A and B antigen on the surface of your red blood cells. If you have type B blood, you have the B. If you have O, you don't have either of those antigens. O is actually like a 0, right? You don't have A or B. The problem with this is if they give you antigens you don't have, what will your immune system do? Attack it, right? It's going to make antibodies against it and it's going to attack it. The interesting thing, too, with the ABO blood group is when do we normally make antibodies? When we've been exposed to something, right? When we've been, quote-unquote, sensitized when we're talking about hypersensitivities. Well, if you've never had a blood transfusion before, if somebody screwed up, gave you the wrong type blood, you'll still have a reaction usually. And the reasoning for this, they believe, is that there are some pathogens out there that have antigens similar to our ABO antigens, or our A and B, you should say. So over time, you're exposed to these pathogens. You produce these antibodies against what you don't have, right? Because your body is not going to make antibodies against yourself, unless, of course, you're experiencing autoimmune. So over your lifetime, like for me, I've probably been exposed to antigens that are like the A-type blood and the B-type blood. Even though I've never had a blood transfusion, if somebody gave me, because I'm O-type blood, if someone gave me A or B, I'd probably have a reaction because I already have antibodies against the A and B antigens. So I can only get O. And basically the rule is you cannot receive any antigen you don't have. So who's the lucky one? AB, because they have both antigens, right? So they probably didn't make antibodies, otherwise they'd be experiencing autoimmune and be killing their own red blood cells right now. That you can give them A or B or A and B and they'll be fine. They're what's sometimes referred to as a universal recipient. O is a universal donor because my cells are naked, right? Doesn't matter what antibodies someone else has. I don't have any antigens on my red blood cells. So I can give them to anybody. Right? They love my blood. If you're O negative, they'll call you all the time and send you stuff in the mail. Right? I'm O positive. It's still quite popular. What's the positive and negative mean? Any of you guys know? Yeah, the RH. And RH is a whole different set of antigens. And it's just really one antigen. You either have it, so therefore you're said to be positive, or you don't, which means you're said to be negative. Hence why O negative is very popular, right? Because they don't have the ABO antigens, and they don't have the RH antigen. They have essentially naked red blood cells. So we can give them just about anybody. Now, are those the only antigens present on your red blood cells? No. There's lots of different antigens out there, but they're minor players. If you have a really rare blood type, when you donate blood, when you get your little card that tells you what your blood type is, right? If you have special other indications on there, they'll write it on there. And depending on the need, like I said, they'll bribe you to try and get you come in more often with free giveaways to get your blood, yeah. But they always have other stuff like, you know, when the mortuary is running at Halloween, they do special VIP passes if you donate blood. They always have some thing going on. I haven't gone in a while, so I think they finally got the clue and quit sending me the little postcards. I have really low blood pressure, so when I've only donated blood once, and I almost passed out. So if I do it again, I have to have somebody to drive me home.
So how come when you're pregnant and you have RH negative, because I had to get the injection?
Yep.
Why?
We're going to talk about that. We're getting to it. It's good. I like it when I have someone who's been through it too.
Yeah.
Okay, so cross-matching. So again, as I said, there's other antigens, so they'll literally mix up the bloods and make sure that they don't react before they put it in you. And they'll, in the blood center, like I said, they type out for like the 20 different antigens that are out there. They do extensive testing when you donate blood, as well as they look for diseases and stuff like that. Why you don't have to worry about you and your baby matching in the ABO blood group is because the antibody you actually produce against the A and B antigens is IgM. And what do we know about IgM? It's big, right? Mega big. Does it cross the placenta? No, and that's why that one doesn't create problems. So even though, right, you're naturally exposed, you'll naturally make these antibodies against what you don't have, and that's why these are major players. And probably evolutionary-wise, it probably made sense for some bacteria and stuff out there to produce antigens that are similar to us, because if you are AB, guess what? You don't have either one of the A or B antigens. So they could escape your immune system because you're not going to make antibodies against yourself, right? It's got to be different. And if it's like you, it's not different. So your immune system doesn't respond in that way. So things that will happen, symptoms, low blood pressure, again, because you have an inflammation response, right? Pain, nausea, even vomiting can occur. So within the population, again, this is genetically inherited, right? So if we look at different ethnic groups related by genetics, you can see that O is very popular, right, among whites, Asians, and even blacks. This is the most popular blood group. But among whites, A is actually a very popular blood group as well, where in Asians and African Americans it's kind of split between the A's and the B's. And of course, the least prominent is the AB blood type. Those are much more rare. Yeah. And in that instance, you're somewhat lucky, right? Because you can get just about any type of blood. And then, of course, as I said, this is inherited, and this is why you can be both A and B. Because you get the A antigen from your mom or your dad, right? Because remember, we're the combination of both of our parents. And so at one time, they even used to use blood typing to help determine paternity. But there are certain cases where you could end up with all 4 different blood types as a possibility for your children. But in like the case for me, I'm O blood type. So I only give DNA that contains no ability to make either A or B antigens. That's all I have. My ex-husband, on the other hand, is B blood type. So my son has 2 choices, right? He's either B or O. That's it. If he's A blood type, somebody's not telling the truth, right? You got issues there. So in that case, right, we could kind of, right, if that was the case, which it's not, although I don't know what my son's blood type is, it's got to be either A or, it's got to be B or O, right? Considering his parents, which are truly his genetic parents. Make sense? Okay. That's something for, you know, genetics class in the good old Punnett squares. But it's always a fun activity. So now hemolytic disease of the newborn. The major player in this is IgG, and why is the reasoning before that? It has the ability to cross the placenta, right? So, and in this case too, you do really have to be sensitized. You really have to be exposed to positive blood before you're going to make antibodies against it. So Rh negative mothers are the only ones that have to worry, right? Because they're the only ones that potentially, if exposed to positive blood, would produce these antibodies. I'm positive. The only way I'm going to make antibodies against myself is unless I'm experiencing autoimmune disease, right? And that's a whole nother ball of wax. But if you're negative, you don't have this antigen, right? Negative means you don't have it, which means if you're exposed, you'll make the antibodies. So for women, there's more ways you can get exposed to positive blood than it is for men because of the ability to be pregnant. So for men, the only way they get exposed to positive blood would be a blood transfusion, right? A large enough amount. For women, it would be a blood transfusion or giving birth to a positive child. Because when the placenta detaches from the uterus, blood exchange could happen between the mom and the baby. And so this is why when you gave birth, they gave you an injection, right? And what they gave you were antibodies against the baby's positive red blood cells so that hopefully your body would not make antibodies against it. So they passively got rid of the baby's red blood cells, any that possibly got in, so that your immune system would not make antibodies against it. So that if you were to be pregnant again with another positive child, you wouldn't have the risk of those antibodies crossing the placenta and attacking your baby. All right, that's the problem there. If you really want to know about that, Dr. LeBlanc, his wife is Rh negative. She's had 3 kids. By the 3rd one, she had to go for multiple injections because she had been exposed to positive blood. I don't know if it was during a pregnancy or a transfusion or what the situation was for them. The other thing is, too, is that for women, if you have a miscarriage, depending at what level of the pregnancy, mixing between that baby's blood and your blood could happen. Also, during pregnancy, if trauma happens to the placenta, that mixing could happen. Right? So there are a couple little extra minor ways that aren't very common, but still something that has to be taken into consideration. Does it make sense to you guys? So it's just the IgG, and again, it's just because that one can cross the placenta. The good news is you actually have to be exposed. You've got to produce the antibodies. And we can kind of hopefully stop that exposure from happening, right? By not giving you the wrong blood, by taking these precautions for pregnant women. Make sense? All right. So let's go on to type 3. Type 3 is an interesting one. So this one involves immune complexes. So the first question is, what is an immune complex? Well, we've been talking about what so far? Antibodies, right? Each one of these we've talked about so far, antibodies were major players. Same is true here. What do antibodies bind to? Antigens. So an immune complex is antigen and antibody bonded together. So the problem here is having too many antigens and antibodies binding, and you get these smaller complexes that don't get eliminated. So remember the cross-linking ability that we talked about? Right? Usually the really big complexes, immune complexes, are going to be easily removed from the system. But if you have smaller, intermediate complexes, they can travel, say, through the blood, and they can clog up really small capillaries in the body. So the same response that we're used to, right? What has to happen first? you got to be exposed. You got to be sensitized, right? You've got to produce these antibodies. But also, right, depending on the exposure, this one's a little bit different because you could be exposed to the antigen and then 7 to 14 days later have a reaction because of the antibodies you've produced and how much antigen is still present in your system. So we'll look at some specific examples, and unfortunately your textbook does not go over serum sickness. So I don't know if you guys noticed I had put a document in our folder for Unit 3, and it has serum sickness in it. So I'm going to flip over to that document right now. Hopefully I left it open. There we go. All right, so it's just 2 pages, I think, or 3 pages. So, and it goes over, you know, hypersensitivity, right? And again, most commonly it's going to be our major players, IgM and IgGs. And we get these complexes that form. The problem is when you have lots of them and you'll get them, they'll congregate in our skin, in your joints. It can really cause damage in your kidneys because your kidneys actually filter your blood. So they have lots of little tiny capillaries in them for this ability to filter stuff out of your blood. If it gets clogged up or damaged by antibodies being there, and then remember, antibodies can elicit immune responses. So if antibodies are stuck in your blood vessels and basophils come by or neutrophils come by, they could be activated by these antibodies stuck in these capillaries. And they can release pro-inflammatory, even destructive enzymes that can destroy those very fragile capillaries. Now, you have about 1 million of these tiny little capillaries in each one of your kidneys, but once they're damaged, they're done. Your body cannot repair these, right? And it does not regenerate them. So kidneys are that important that I guess they decided to give us 2, right? You kind of have a backup copy, you could say. So, serum sickness, the problem with this is it's systemic, right? So this is something that'll happen system-wide. And most commonly it's due to passive immunization. Remember we talked about this before. This is when somebody passes antibodies to you. So you didn't make the antibodies, right? Someone else made them and they gave them to you to help protect you. The problem is if those antibodies came from another animal instead of a human. Over time, your body might recognize, hey, this antibody, this protein, isn't actually mine. I didn't make this. This looks different than mine. And you produce an antibody against that antibody. So 7 to 14 days later, if you still have a lot of that antibody left that hasn't been eliminated from your system, then you have your antibody now that you produced, and it can bind to it and elicit immune responses where you have these immune complexes building up in your system. You had a question?
I was just going to ask, how do you receive the passive immunization? What I was reading there.
They give you a shot. Yeah, they give you a shot. So this is artificial. What's natural passive? How do you get antibodies from someone else naturally? Breastfeeding, yeah. Mother to baby through the placenta, because IgG crosses, and then also breastfeeding, you get IG what? A. G in the colostrum, in the very first milk, but all throughout breastfeeding, IgA is given to the baby. So examples of this in the past is people, again, when we were given animal serum. So because of that potential risk, horse serum is no longer used for passive immunization for diphtheria and tetanus. So when they give you antibodies to help protect you against diphtheria or tetanus, they're from humans. And again, this is one of the other benefits of when you donate blood. If you have a large percentage of these antibodies against diphtheria or tetanus, they can take this out of the liquid phase of your blood, that serum phase of your blood, and store it up to be able to give to people to help protect them. Yeah. Yeah. They're not kidding when they say you can save up to 5 lives with just 1 pint of blood, because they take so many different things from it. They divide it up in so many different ways. So the other interesting thing that gets me is the anti-venom when it comes to snake bites. Another one that sometimes will cause problems for people is the enzyme streptokinase. Is actually produced by bacteria, and they sometimes give it to heart attack individuals because it will dissolve clots, this enzyme. And but unfortunately, some people will produce antibodies against this enzyme. So a little bit later, they'll have that reaction where the antibodies are reacting to it. The anti-venom, apparently snakes are kind of like hyperimmune, or it can very easily produce antibodies against snake venom, probably because they're so much larger than we are, right? And more likely to get bit. They can survive a snake bite and actually produce antibodies against it. So then that helps protect them if they were get bit by that same type of venomous snake again. So what they would do is they would take anti-serum again, take the liquid phase of the blood from horses, and save it to give it to people when they get bit by snakes. And there are different venomous snakes out there, so there are different anti-venoms. And that's why sometimes it's to the benefit to know what type of snake you got bit by, so they give you the correct type of venom. But they also combine, they combine the anti-venoms now where, they can give you just 1 shot and it has all the anti-venoms in it. The problem with that is, again, those are horse antibodies. So you could potentially produce antibodies against that antibody. So if you were stupid or crazy enough to get bit by a snake again, right, or even, 7 to 14 days after they give you the antivenom, you might have a reaction, right, when your body starts producing antibodies against that antibody. I took a herpetology class in grad school here at Southeastern. And my professor was like, why are you taking this class if you're terrified of snakes? I'm like, because I want to know if I need to run or sprint when I see one. I've figured out, though, sprinting is always the best option. I was all excited about the frogs. I like frogs. But we saw snakes mating, and my professor almost stepped on a snake. And I saw it, because I was like this the whole time. I do not want to step on a snake. And, in Louisiana, we have most of the venomous snakes here. Having moved here, I'm like, ah. My son loves to go to the reptile house at the zoo. I love my son. I go in there. And the last time we were there, one of the most poisonous snakes on earth, like the green mamba or something like that, was really active. And I'm videotaping my son, and he's just talking away. He's going to be one of those zoo kids one of these days, right? Where they go around and tell everybody who visits the zoo. And I posted on YouTube, and my friend's like, that's probably the most venomous snake on earth. It's like, great, thank you for telling me that. It'll be another, year or so before my son can convince me to go in that place. They're all in cages, but it gives me the heebie-jeebies. But there is actually an even crazier person out there. I call him the crazy snake guy. And I think what he has done is purposely injected himself with small amounts of venom to make himself immune. Right? So he is immune to just about all the snake venoms, and apparently even sells his serum. Because again, it's human serum. So people don't ever really have to worry about having a reaction because it's human. I did some research into this too, and they don't really use horse serum anymore. Apparently they use pigs more often now for generating the anti-venom serums. And again, less likely of a reaction because as I mentioned earlier, we're very closely more related to pigs than we are, of course, horses. So genetically, those antibodies aren't quite as different, and our body less likely to mount a response against it. So that's a really interesting, situation where, again, anything different, there is a potential that our immune system will recognize it and respond. And in this case, the reason why they gave you someone or some other animal's antibodies was to try to protect you, not make you sick, right? But it's not a perfect system. It could relate to problems. With me? So again, too, like, this can even happen to people, like, if you get the immunization too much for diphtheria and tetanus, you could have a reaction in your skin where, again, your antibodies that you already have react to the vaccination. That's not such a bad thing, but if it was happening in your blood, it could cause a serious problem. And when they give you anti-sera, when they give you those antibodies, they put that right into your blood. So kind of wheeling back for a second to type 1 hypersensitivities, food allergies, it makes sense, right? You ingest something, it goes into your blood. Can anyone think of another allergy where people have such a severe, where it could potentially enter into their blood that they actually carry around a EpiPen? Anyone ever see the movie My Girl? I watched it once. I won't ever watch it again. Cried like a baby. Out of the theater, just... The little girl, or little boy, because the little boy dies, or it's the little girl. I can't remember which one. It's been a long time. Bee stings. Gets attacked by bees. So, like, any venomous ones like bees and wasps and stuff like that, which I'm allergic to wasps too. It's great. If they bite you and it potentially that venom gets into your bloodstream, which sometimes can happen, for some people that are extremely allergic, right, they would have to carry around an EpiPen because, again, it went into the bloodstream. And it could cause a serious problem. So this is why, too, for people who are penicillin allergy, too, right, it can be quite severe for them. No, wasps sting. Actually, the fire ants here have stingers, too, and it is venom that they inject into you as well. They'll bite you. They bite you to hold on, and they take their little butt and stab their little stinger into you. And it's venom that they're sticking into you. It's actually a really strong acid in it, too. But yeah, the ants are actually stinging you. Wasps sting you with their stinger. Bees sting you with their stinger, and is quote-unquote referred to as venom they inject into you. They're just trying to defend themselves. Mud bugs. Do you guys know about mud bugs? No, different ones. They're the ones that they're a type of wasp, and they like make the little mud casings. I don't think they're black. I think they're all black, I want to say. But they make those little mud encasings, right? Unlike wasps that do the nests. They're a relative of a wasp, but they don't sting, apparently. Although I didn't know that when I first moved here. So the first time I saw one, I ran like crazy, and everyone was laughing their ass off at me. They're like, they don't bite you, they don't bite. I was like, I wasn't taking any chances. Yeah, they are a wasp relative, so they look like wasps. And then, like I said, they act like wasps. So, I ran like it was a wasp. I ran as fast as I could. Run away, run away. All right, we're almost to break. We got one more hypersensitivity I want to get through, and I closed my darn PowerPoint. All right, so type 4. So let me finish up with 3. So again, as we talked about, it's this interaction of antibodies with antigens, and it could be that you were injected with too many antibodies and have too much antigen, and the problem is these can collect in the skin, the joints, and the real problem is when it's in the kidneys, or if you have massive amounts, right, and it can cause a condition referred to as disseminated intravascular coagulation, and that's again where they're collecting in the small blood vessels. and causing that inflammation and damage of your capillaries. So it can be quite a serious and damaging condition if it persists. Although these are extremely rare. Type 3 hypersensitivities. Probably might be the only time you hear about it is in this course. Type 4, on the other hand, we actually employ this ability of our immune system all the time. Type 4 is referred to as delayed cell-mediated. So this is the only one that doesn't involve antibodies, but actually involves immune cells. And again, your immune system, when you have an infection, produces these memory cells, right? Memory T cells that remember what they've been exposed to. So being able to detect and know when your immune cells have seen something before is beneficial. So this type of reaction we can actually use to help diagnose infectious disease like tuberculosis. So the tuberculin skin test that they perform on you is they purposely inject you with proteins related to the proteins of the mycobacteria tuberculosis. And they're looking to see if your immune system has seen it before by seeing if those sensitized T cells travel to that area and enlist an inflammatory response. So this will create a characteristics bump, right, in your skin if your immune system recognizes and responds to this protein.
So you don't actually have it, you could have had it in the past.
Right. So this is the thing, though. Once your immune system knows something, it knows it pretty much forever, right? So once you have a positive tuberculin test, you will always have a positive tuberculin test. You get a special little card once you end up with a positive one, because there's no point in doing it again, because it'll come out positive. So, like she said, it doesn't necessarily mean you have the infection, it means your immune system is recognizing it. So you could have previously maybe had the infection, or what's another way you can get previous exposure to antigens without getting sick, that we artificially do to you? Injections, vaccination. Do we vaccinate against tuberculosis in the United States? We do not. Not to the general population. The general population is not vaccinated against tuberculosis. Because if we vaccinate you, can we TB test you? No, it's always going to come out positive. Very small populations of individuals are vaccinated against tuberculosis in the United States. One of the main reasons for that is it will eliminate this early detection as useful. And the other is the vaccine that is currently available is very low effective ability. It's not a very good vaccine. So my ex-husband was vaccinated twice. He worked in a prison as a guard. Worked. Unfortunately, tuberculosis is very common in the prison system. So to help protect their guards, everyone is vaccinated. He was also in the military and was deployed overseas. And it's one of the things that they have to worry about is tuberculosis. So they vaccinate for that. So he was vaccinated twice. So chances are he's probably developed an immune response to it. LSU gets a lot of international students. So unlike here at Delgado, they require the TB test. He went to the health center, right, to hand in his vaccination records, which are 5 pages long from being in the military. All the things he's been vaccinated against, like smallpox and anthrax and TB, and you name it, right? And he hands it to the girl, and she's like, well, you got to have a TB test done. He's like, well, it's going to be positive. The girl freaks out, right? He's like, I just gave you 5 pages of vaccines. It's on there twice. I'm probably going to be positive. She's like, well, I've got to do it anyways. So she does the injection. A couple of days later, he's like, honey, I don't understand. I'm not having a reaction. So I don't understand either. I mean, you've been vaccinated twice. I know it's a shitty vaccine. I mean, what are the chances of you not being positive? This is not likely. And I was like, well, she didn't seem very knowledgeable considering she freaked out when you said it was going to be positive. She should know for some people, especially how many international students they get. In other countries around the world, they do actually vaccinate, right? So there's a very high percentage probably of people that come in there that end up being positive. But it's not because they have infections, because they've been vaccinated. Their immune system recognizes it. So what I deduced is that she improperly injected him. It's a protein that's usually in solution, and that vial, if that protein can settle out of solution. So she didn't shake the vial and make sure she picked up some of the protein. She may have probably just given him a saline shot. So I said, you definitely need to go report that girl. He was happy, though, because what's the next step if you have a positive test? Chest x-ray. Right? That's the only other way they're going to be able to deduce. Well, there are other ways, but that's one of the most common quick diagnostic tools that they'll do. So, those of you guys that are going into the health field or are currently already in the health field, depending on where you work, they may do the TB test as often as every 6 months. More commonly about once a year. Please do not be one of those people that freak out if you come out positive. Because there will be the potential, depending on how and if it was administered correctly, that all these TB tests, you might actually, it'll be like you've been vaccinated. So your immune system remembers it one of these times you've been tested, and then as I said, once it remembers it, you'll always be positive. So don't freak out, right? Unless you've, been exposed recently to a TB patient or something like that, right? There are other parameters. Anyone know why we use this particular test? TB is a very slow progressing infection. So it's one of those easy early detections because most people don't show symptoms for a very long time. So it's one of those early detections because, literally you could have it for a year and not even be coughing up a lung yet. The scary thing with this one is all the antibiotic resistance we have out there now with this infection and how infectious it is. As little as 10 bacteria, if you inhale it, you could potentially get this disease. It's highly virulent. Yeah. Remember, it survives in your macrophages. We do have antibiotics, but again, the scary thing is that we've got a lot of strains that are resistant to most of the antibiotics that we have available to us. So it's a very scary world when it comes to tuberculosis. And unfortunately, Louisiana is pretty high on that list of individuals that are infected. So the important thing here is, again, your immune system is responding. The only difference between the other hypersensitivities, it's sensitized T cells that are remembering it, right? And so again, once positive, you're always going to be positive. You're always going to have those memory cells that are going to infiltrate into the area. So ready for a break? So before we break, what did I want to say? So it's your T cells that are responding in this case. That's why it's called delayed cell, and that's again why it takes a couple of days, right? You need those cells to recognize and get called to that area. So much so that you actually see that inflammation. So other allergies that can be type 4 hypersensitivities where it's actually cells that are responding are poison ivy and poison oak. Some people, the nickel, when you buy what we call costume jewelry, like from Claire's and cheap stores, it's typically nickel plated in silver or gold, and so that plating can rub off over time, and then you're exposed to the nickel. So there are some people that are allergic to nickel. One of my aunts, can't wear costume jewelry. She's like, it's the way it should be. My husband, she has to go to the real jewelry store to get me jewelry. Right? She can only have the real stuff. She can't wear any costume jewelry. Otherwise, she'll have a reaction. The chromium salts that are used for preserving leather, some people are allergic to too. So you can actually be allergic to leather. We won't talk about any jokes related to that right now. Use your imagination. Latex is another one, and of course that was widely used for the longest time and still is in some manufacturing of some medical devices, and even gloves for the longest time, and condoms and such were made of mostly latex. This is from, I think it's a byproduct of the rubber tree, latex is, but Most places, including Delgado, we've stopped using that because of the potential of allergy for some people. So we buy latex-free gloves now for everybody. And that's one of the allergies that for some people, too, it could be a type 1 hypersensitivity or it can be a type 4 hypersensitivity. Type 1 is when it happens immediately, right? And type 4 is like, you know, a little bit later. And so sometimes that can be harder to detect what it is that's going on because, you know, 1 or 2 days later you break out and you're like, what's going on, right? Or in the case of me, I developed an allergy to one of the lotions I was using. I was like, what the heck? I had to throw that out. It took me the longest time. My son had gotten poison ivy or poison oak or something. I'm allergic to poison oak. I don't think poison ivy. And I thought that, like, I had gotten it from him. And then he was away, and I kept breaking out. And so it's like process of elimination. Oh, it's solution I'm putting on my legs. I'm allergic to that. Nice. Stop using that. But, yeah, so sometimes it can be difficult to figure out what's going on. The important thing with this one, as I said, it's T-cell mediated. It's actually the T-cells that are recognizing. And a lot of times what happens with this is that these oils that are with poison ivy and poison oak attach to your cells, so your immune system even starts attacking your own cells. And that's why sometimes, too, it gets really gross, like you see in this picture. I remember a kid once when I was in school had gotten poison ivy, right, and he had the huge blisters. Gross. The good news was with poison ivy and poison oak is that if you know you've been exposed to it, there are special cleansers that you can buy from the local drugstore that can help try and remove it, hopefully before it incorporates into your skin, so that hopefully you won't develop a reaction. And again, the very first time you were probably exposed to these, you didn't have a reaction. You became sensitized, though. So then the next time you're exposed, you have the reaction. And then again, like I said, each time you get exposed, it can be a more serious, right? Because again, your body is aggressively thinks it's foreign, right? Thinks it's potentially something bad. So it responds much more aggressively because each time you get those memory cells that are going to be activated and more are going to be produced. So it gets to be a more severe reaction each time, right? And the unfortunate thing is if people don't recognize what poison ivy or poison oak looks like, if you live out in the surrounding parishes, I've known people unfortunately get infections in their throat and respiratory from burning it and inhaling it. So, you know, if someone's burning brush and you have those type of allergies, stay away because they might not be the smartest cookie in the box and be burning something they shouldn't be and letting those toxins into the air. All right, let's take a break.